This is Kathleen Oviedo, and I'll be your host for today's webinar entitled The Future of Military Health, How to Make the Most of the TRICARE Changes. Joining me today is guest presenter Christopher Lopez from the Department of Defense. He'll be sharing just about 30 minutes of slides for you today. If you have any questions during the presentation, please feel free to reach out to us by phone or email. Before we begin our presentation, just a few words about AAFMAA. AAFMAA stands for American Armed Forces Mutual Aid Association, and is the longest-standing, not-for-profit association that empowers military families with affordable financial solutions. AAFMAA focuses exclusively on the needs of the military family and works to provide innovative, personalized, and lifestyle-appropriate financial solutions. We accomplish this by being the premier provider of affordable life insurance, expert investment management, customized residential mortgages, and exclusive survivor assistance services, all for the military community, not for profit. This presentation is educational. It's for general information only and is not specific investment, legal, or tax advice for any of you individually. Do not rely on this presentation alone to guide your insurance decisions. Since each individual situation is unique, the life insurance that benefits you the most will not necessarily be the same as another current or former service member. For individual advice, please contact us directly. We produce this webinar series in-house with our own professional staff as a service to our members and to help them better understand the resources that are available to them. I'll now go ahead and turn it over to Chris to begin the presentation.
Well, great. Thank you, Kathleen, and for the invitation to be here to participate in the webinar. It really is a pleasure to be here. I was here about a year ago and happy to provide your members with an update. So Vice Admiral Bono, my boss at the Defense Health Agency, has asked me to help inform your members at AAFMAA what's happening with TRICARE, and there's a lot happening. She stresses every day the need to design our health plan with our patients in mind and to seek your input so that we can serve you better, and really that's why I'm here. So on slide 2, you'll see Admiral Bono begins almost every presentation with this slide. And the point that we're making here is whether it's a service member deploying in harm's way, the family they leave at home station, or the retirees who have served our nation so well, we need to keep our beneficiaries at the top of our mind. That's why we're so excited about the changes coming to the TRICARE health plan, your health plan. There are changes that are mandated by Congress, the National Defense Authorization Act passed into law the last few years, and there are changes that we've made in our new contracts. So the combination of those two changes and some other things, we're working to make sure that we provide a stronger, more integrated, and more patient-centered system for our patients and beneficiaries. Next slide, please. There we go. Before I get into the changes, I want to take a moment to discuss your military health system and let you know where the Defense Health Agency fits in. A little, I guess, commercial PSA. In addition, I think it's important to understand that your military health system does a little bit more than to manage your TRICARE benefit. So the military health system is a worldwide system of health and readiness with unparalleled breadth and capability. Our primary mission, which isn't a surprise to most folks, is to ensure the health and readiness of America's service members to go anywhere at any time. And in support of this mission, we also deliver and coordinate care for 9.44 million Americans, which includes service members' families as well as the retirees, many of those members of the AAFMAA community. So the military health system is comprised of several areas. I mean, you'll see the SEALs on the slide there. I won't go through each one of them, but it's a team effort from both the Secretary of Defense staff and the service staff as well. So a lot of coordination. Same slide here. And we aren't like any other healthcare system. And ultimately, we have the primary mission of readiness and readiness of the force, like I mentioned, and this includes 1.3 million service members and about 800,000 members of the reserve component. We operate 55 hospitals and roughly 373 clinics, which is a pretty large breadth. We manage the global health benefit through the TRICARE program, which I know folks are most familiar with. And we ensure public health, something that some people probably aren't as aware of. I mean, we safeguard the air, the water, and the food safety in all the military locations. We also monitor infectious disease worldwide to protect our service members and all Americans. We have a robust training and education capability. We operate a medical university and have a substantial research and development component. So a lot that we have going on in your military health system. So just as I mentioned on the last slide, the primary mission of your military health system is to ensure the health and readiness of America's service members to go anywhere at any time. This directly supports Secretary Mattis's priority of increasing readiness and lethality. In addition, you'll also see that one of SecDef's priorities is to reform business processes. One of those processes is reforming the MHS. If you go to the next slide, you'll see that why the SecDef is looking at military health. So there's something called the Fourth Estate, which most folks are not familiar with, but it's basically all the agencies within the Office of the Secretary of Defense. So you'll see on the slide that the Defense Health Agency represents 35% of the breadth and the girth of all the agencies under the Office of Secretary of Defense. So ultimately, they're looking at trying to streamline what we do. If you go to the next slide, this is why we're working with Congress and DoD leadership to reform not only TRICARE, but the entire military health system. What you'll see on the left is the current state where we have 3 independent health systems, really 4 if you count the National Capital Region. So that's the Army, the Air Force, the Navy, and the National Capital Region. For those who have been to our military hospitals, you know there's a great degree of variability to your care. Everything from how you make an appointment to the clinical practices. To the right, you'll see where the MHS is moving. We want to eliminate redundancy, improve care, and be more efficient. Next slide, please. This is where the Defense Health Agency comes in. The DHA is a combat support agency and is bringing an enterprise approach to clinical and business processes across the military health system to reduce variation and to increase standardization. What is a combat support agency? Some people ask. Simply put, we're here to ensure the combatant commanders have the medical capabilities they need to meet their missions. What does that look like? Well, a few examples include employing a standard electronic health record. I think there's a lot of interest in that, even from your members. Managing a single pharmacy contract, so bundling pharmacy contracts across the services to gain not only buying power, but to standardize formularies. So when you go to MTF, you have the same access to the same types of pharmaceuticals. And providing training on the same equipment that our service members will use at the MTF that they'll use downrange. So they have that competency, and then being able to quickly move vaccines and other medical material to high-risk areas across the globe at a moment's notice. I mean, whether it's an AIDS epidemic in West Africa or other types of scenarios. Over the next several years, the Defense Health Agency will also begin incrementally overseeing the administration and management of all military hospitals, which the Army, Navy, and Air Force currently run. To the patient, this is going to mean more standardization and better care. So that's good news for the retirees who are TRICARE Prime and get their care at our facilities. To the department, this of course means more efficiency and the ability to enhance lethality. So the DHA will also help integrate that purchase care and direct care component. Now on to TRICARE Changes, which you've all been patiently waiting for. I always like to start off with this slide because I want to remind folks that we are truly honored, both in the military health system and at the Defense Health Agency, to administer one of the most comprehensive and robust benefits in the world in support of those who have served and served, and in many cases sacrificed and made the ultimate sacrifice. So this includes spouses and families. I'm a reservist myself. I have a family, and I know my family, my wife, my kids make much greater sacrifice than I do. So very important that we take care of the families, that the TRICARE benefit remains robust. So I like this slide because it's important to see where your TRICARE benefit stacks up in terms of size with the leading healthcare insurance and healthcare systems. Even though there's less than 1% of the U.S. population serve in the military, you can see we have a relatively sizable number of beneficiaries that we serve. So in comparison to kind of the rest of the nation. So on this slide, we're updating you on some important improvements to your plan that we're excited to share, and a good information for you to have as you plan your finances and plan your healthcare year to year. We're increasing the adequacy of our purchase care network to reach 85% of our beneficiaries. So what does that mean? Well, first, it was only 68% in 2017, so moving up is always a good thing. But ultimately, this means that you're going to have an easier time finding a provider you like. And we're focused on the patient experience, and we want our patients to make sure they have providers that they're comfortable with and have adequate access. We're standardizing appointing processes across the MHS, which means you don't have to learn a new appointing system every time you move to a new military hospital if you're in TRICARE Prime. And that's been a challenge because there's always some backdoor way when you go to another MTF that you have to find out how do I get an appointment, who do I talk to, but we're standardizing those processes to make it easier. We're also expanding telehealth and mental health. With regards to mental health, we took the limits off all mental health care visits, which is a big deal. We think that's important, and we want to make sure that we incentivize and encourage folks to get the mental health care they need. We also eliminated copays for the majority of the preventive care, such as health screening, et cetera, from the TRICARE Select, which is our preferred provider option. So now I want to quickly walk you through some of the changes that occurred in January 2018 this year. So these are changes that are already working, that are important for folks to know. The reason I want to touch on them is because many people don't use their health care but once a year. So, we're sitting here in August, and there are folks who haven't seen their doctors probably since sometime in 2017. So first, there is a requirement for active duty family members and retirees to be enrolled in either TRICARE Prime or Select. That's if you want to use your benefit, and that's a paradigm shift. Gone are the days where you kind of walk off into the sunset, retire, and have TRICARE, what used to be TRICARE standard coverage. You actually have to enroll. Most folks are auto-enrolled, so you don't have to take any action, but it's important you understand that now enrollment is part of using your benefit. We also transitioned from three TRICARE regions to 2, which has made it easier for families when they PCS, and is less overhead for the government to manage. This means that we can make your tax dollars go further, of course, but the main takeaway for you is that if you haven't seen your doctor since 2017, like I mentioned, is you need to make sure that they're still in your network because our managed care support contractors have changed. So take a look at their provider directories, either at Humana Military or at Health Net Federal Services. And before you go visit your doctor, on the next slide, I will discuss 2 more changes that are taking place in November, affecting how you enroll into health plans and the TRICARE Retiree Dental Program. We want to make this transition as easy as possible in 2019. Starting this year, there'll be 2 different open enrollment seasons for certain TRICARE beneficiaries. There'll be a TRICARE Open Season and an OPM FEDVIP Open Season. So TRICARE, we're establishing an annual TRICARE Open Enrollment Season to improve your TRICARE health plan. So I know people will look at, okay, now I have to do something that's more work for me. But the reality is this is going to help us attract more providers to the network. Because when it comes to, they'll have more predictability as well as we'll be able to establish a care where you're actually using your benefits. So right now, or prior to 2018, before you were required to be enrolled, we had 9.4 million beneficiaries that had access to the benefit, but we really couldn't track who was using the benefit and then making sure we're building the care networks around them. So we think this is going to be a huge improvement for and improve the experience of care for our patients. If you like the plan you're in, the good news is we've made it simple, and like I mentioned before, is you don't have to take any action. However, starting in 2019, you'll need to use a TRICARE Open Enrollment Season to change plan. That's for if you want to change between TRICARE Prime or TRICARE Select. Or you'll have to change plans after what we call a qualifying life event. I'm also excited to announce that I mentioned FEDVIP before, so I hate just using acronyms without spelling it out. The Federal Employees Dental and Vision Insurance Programs, dental programs will be replacing the TRICARE Retiree Dental Program beginning 2019. So that's a big deal because those who are on TRICARE Retiree Dental Program, if they want to maintain coverage dental-wise, they'll need to go to the FEDVIP Open Enrollment and sign up this open season. As well as for the first time, we're excited that active duty family members and retirees will have access to vision benefits through FEDVIP as well. Like I mentioned, there'll be no automatic enrollment, so eligible enrollees need to take action during the FEDVIP/OPM Open Enrollment Season if they would like dental or vision coverage in 2019. So again, 2 different websites, 2 different open seasons. However, they happen to be at the same time every year. So it's easy to remember, but we want to make sure folks are clear on where they need to go for both the TRICARE Open Season and the FEDVIP Open Season. And that information is on the slide. So moving on to qualifying life events. Wanted to park here for a moment. The reason we have this slide is because we realize for our population, this is a new thing. So in addition to being able to change your plans during open enrollment season, if you have a qualifying life event, you can change your plan up to 90 days after that. So that's important to know, and we have them listed there. And in fact, we have highlighted in blue just ones that are more specific to our military community, that typically aren't included in, I guess, private healthcare insurance. So a little bit more on the retiree dental coverage. Like I mentioned, the TRICARE Retiree Dental Program, also known as TRDP, ends December 31st, and it's transitioning to FEDVIP. So TRDP is a voluntary dental insurance program for retired service members. Anyone who is in TDRP this year, like I mentioned, and you're catching a theme here for things that we need folks to pay attention to and take action. We're mentioning a few times, and that's okay. Rather have them say, "Gosh, why?" Get a little bit irritated if we mention it several times versus not remember. So they need to choose among the 10 dental plans from FEDVIP if they want to retain coverage. Of course, if they don't need coverage, they'll just be transitioned out of TRDP. You can enroll with OPM through FEDVIP, through the FEDVIP site, which parallels TRICARE's open season, like I mentioned, and in 2018 is 12 November to 10 December, and that's written on a bunch of the slides, but I figure I'd say it. And so when you enroll this fall winter, this plans actually take effect in January 2019. So as I mentioned about the vision coverage, this is an exciting new benefit. There is no vision coverage for active duty family members and retirees. You have some access to eye exams at the MTF and a few other things if you're TRICARE Prime. But otherwise, if you have a family need where you have a bunch of children, or you have a specific need in your own life where you need glasses or some specific eye care, there really is no coverage for our beneficiaries. So we're excited to work with OPM to be able to offer 4 vision plans starting 2019 that folks can choose from. And similar to the dental programs through FEDVIP, they'll have to sign up during open season, the FEDVIP OPM open season, and go to their site. So check the mail. So we definitely appreciate AAFMAA for hosting us here, but we're also making sure that we reach out to our beneficiaries directly. So we have roughly 4.1 million postcards that we're sending out to our beneficiaries, anyone who is either eligible for the TRICARE Reserve Dental Program, or either has it or will be eligible for the Vision Program through FEDVIP, making sure they know about these changes. But I want to encourage folks, if you haven't received your postcard yet, it's okay, because what I found out is it actually takes a while to mail 4.1 million of anything. So we started mailing them in June, and it's probably going to take through the end of August, maybe early September. There are folks that will probably get it a little bit later. So don't worry if you haven't got it. And if you have questions, of course, please reach out to us either way. So I always want to make sure that we kind of do our key takeaways here. Our guidance to families. First is we want to spread the word. Tell your other beneficiaries that you know, so that they have the information and can make informed healthcare decisions moving forward next year. But the first point again is TRICARE Open Season. This year it's 12 November to 10 December in 2018. Again, no action needed if needed year to year. So we're going to have open season every year. You don't have to take any action at all each year if you like your plan. We're going to keep you in the plan. It's only if you want to change plans. That's the deal. Or you can change plans, like I mentioned, after a qualifying life event. You'll see a website there that you can go to for more information. Next point is just the TRICARE Retiree Dental Program. Again, is transitioning to FEDVIP in 2019. So if you're a TRDP enrollee and you want dental coverage, you need to go to the TRICARE benefits site during the OPM FEDVIP open season, which again is the same time as a TRICARE open season, but different site, and make those enrollments. The new vision coverage is available. Again, a new exciting thing for our beneficiaries that we're looking forward to offer to them. That again is at the OPM FEDVIP site, which is listed there on the site. And final note is for folks that are retiring. I mentioned earlier in the brief, when you retire, you need to make sure that you enroll into a plan. It used to be where you were just covered by TRICARE's, what used to be standard. So we're encouraging folks to pre-enroll as soon as they can. They'll be able to pre-enroll as soon as their service inputs their retirement date into DEERS. So just keeping track with that, because if you're able to pre-enroll, it makes it a lot easier. Ultimately, though, they'll be able to be reinstated up to 90 days after they retire. So we'll backdate any claims and cover anything that happens. So ultimately, it's just different, though. They're going to have to take action and make sure they're aware. So to drill this point home, I mean, please, anyone who's listening, just spread the word. There's a lot in this brief. Everything can be found on our website, which will link you to OPM's website for what's appropriate. But please spread the word. The real common theme is, as we're making changes to your health plan to better serve you, you have to take a little bit more command of your health and just be aware of what decisions you have to make. Where in the past, I mean, basically everything was kind of just there for you, but it didn't necessarily fit everyone's specific situation. So we're trying to make this where folks have a more tailored experience that meets their specific needs. I'll end with this, although there are folks that are probably listening that were probably waiting to hear about this. There is no change to TRICARE for life, and those are for folks that are retirees that are TRICARE eligible, that are 65 or over. We have this slide here to make sure that folks understand that, but also as a bit of an education for folks who are nearing 65, because you'd be surprised of just what folks don't, the actions that folks don't know they need to take. The first thing is they need to make sure if you're going to turn 65 and you're TRICARE eligible and you're using a TRICARE plan, you have to sign up for Medicare Part B to continue with TRICARE for life once you turn 65. And what's going to surprise people is that the premiums are a bit different. They're a lot lower before you turn 65. I mean, it's not anything we control. This is all enacted in law, and it's means tested. And you'll see on the slide that it's there are about, I think, 6 different tiers. So if you're continuing to work and you're making a lot of money, then you'll have a higher monthly premium for Medicare Part B. Again, that's not a TRICARE managed payment. That's a Medicare payment. So it's important that people are aware of what that costs. Ultimately, Medicare will be the first payer on any care you receive, but then TRICARE will pay anything, most things that they don't cover. But it's important. We like to do a little bit of education when we mention TRICARE for life, because we know, especially your population, you have a mix of folks that are retired TRICARE beneficiaries below 65 and above 65. So, and we always like to encourage folks to follow us on social media. So you'll see our Assistant Secretary of Defense for Health Affairs and our Director of the Defense Health Agency, and you can follow them on Facebook, Twitter, follow them on our websites. So we encourage you to do that, to stay most up to date. And we just appreciate the opportunity to, again, brief AAFMAA's members and just to be with you here today. So thank you.
Thank you so much, Chris. That was very informative and very helpful for everyone listening. I encourage you to download all of the handouts and the slides that we have included with this webinar so you can go over everything in your own time. We'll go ahead and break here for now, but you can reach us whenever you need to. Please don't hesitate to ask for help. We do this every day for a military community, and it is our pleasure. You can always register for future webinars and review past webinars at aafmaa.com/webinars. If you found this information useful, we encourage you to please share it with your friends and family. Our membership grows stronger every year because you introduce those in your military community to AAFMAA. Thank you again to everyone listening. We look forward to our next opportunity to assist you.